I would like you to pay attention because colon cancer is rising at an alarming rate worldwide, and it is completely silent. This is a cancer that has completely caught us by surprise, and each day it could bring more surprises because we often don't notice it, and by the time we do, it's usually too late. In this video, I want to talk to you a little bit about how colon cancer has been increasing, and we will also discuss how it has been evolving. I will tell you about the early and late signs of colon cancer, what tests you can do, when you should start getting them, and when it's crucial to visit the doctor to discuss whether your symptoms could be related to this disease. With the right information, we can work together to make colon cancer less frequent, as the best tool to fight it is prevention and early diagnosis. When we effectively prevent and detect early, the outcomes can change drastically. That's why I will also share with you what medical literature says about the main risk factors, what actions you can take in your daily life, and which foods you can include in your diet to reduce that risk. Although no one can guarantee that you will be completely free of this disease, we can significantly decrease the chances, as we are increasingly aware of the cumulative effects of cellular damage over time. For these reasons, I invite you to stay until the end. I will provide all this information so that you are well informed and can make the best decisions for your health. It is common to wonder why cancer is on the rise. We have been taught that it is primarily a genetic disease and that we should focus on family history. However, only about 5% to 10% of cancer cases are genetically inherited, the rest are due to multifactorial causes. This means that what we do in our daily lives, our habits and actions, has a much greater impact than the genetic information we inherit. Epigenetics shows us that, although we may carry a gene associated with colon or stomach cancer, its activation depends on the environment we live in. It is this environment that influences how a gene behaves, determining whether or not it is expressed. In other words, our decisions, habits, and lifestyle play a crucial role in this process. That's why I want to explain how your habits can become a powerful tool when applied with a scientific approach. This is especially relevant in the case of a type of cancer that often goes unnoticed in its early stages, even by doctors. Let's remember what the large intestine, also known as the colon, is and its role as the final stage of the digestive system. In the colon, nutrient absorption is practically non-existent, as it serves other functions. So, what is the purpose of the colon? After nutrients are absorbed in the small intestine, the contents that reach the colon are very liquid. If we eliminated this content in its current state, we would suffer from severe dehydration. This is because, on average, the body processes about 15 liters of fluids a day from saliva, tears, mucus, and more. The colon's job is to reabsorb much of that fluid, returning it to the bloodstream. It functions as a kind of drying system for the content it transports, moving it through its different sections: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, and finally, to the rectum and anus, where it is eliminated as stool. When the content reaches the sigmoid colon and rectum, it should be much drier, transforming into a soft paste, like the consistency we see in feces. This is one of the colon's main functions. Additionally, it plays a crucial role in the immune system and in regulating inflammation, thanks to the function of the intestinal microbiota. The microbiota is present throughout the body, in the skin, small intestine, stomach, esophagus, mouth, eyes, uterus, and more. However, the microbiota in the colon is likely the most abundant, both in quantity and in species diversity. This microbiota has a close relationship with the immune tissue located just beneath it, forming part of the immune network that extends throughout the body. It is important to remember that about 70% of the immune system is located in the gastrointestinal tract. In this area, we find a series of key protective barriers. The first is the mucus layer that coats the intestine, followed by the tight junctions between intestinal cells, especially in the small intestine, and finally, the immune barrier. These three layers work together, and their stability heavily depends on the microbiota. Lastly, another essential function of the colon is the elimination of waste in the form of feces, a process that is indispensable for the body's balance. It is important to remember that this type of cancer is alarmingly common. In 2020, approximately 1.9 million new cases were diagnosed worldwide. It is the third most common cause of cancer in the United States, and additionally, cancer is the second leading cause of death globally, regardless of the country. This cancer is more commonly observed in countries with highly industrialized diets, such as the United States, Canada, many European countries, and Australia. These places typically have a high consumption of ultra-processed foods. Furthermore, the risk of developing this disease is higher in individuals with obesity, smoking habits, excessive alcohol consumption, or a family history of colon cancer. These individuals should pay special attention to their health and consider preventive and early detection measures. Let me explain it with an everyday example. Imagine the pipe under a sink. That pipe is designed to handle water, toothpaste residue, and a little bit of soap. Now, if you start pouring hot oil, petroleum, and toxic chemicals into it, what will happen? The lining of the pipe will begin to deteriorate, deform, and could even get punctured. The same happens with the intestine when we overload it with unhealthy foods, lacking fiber, and full of inflammatory substances. This poor diet, combined with an unstable microbiota and chronic inflammation, can cause changes in the cells of the intestinal lining. These cells can become abnormal, and one of the first signs of this process is the appearance of polyps, small mushroom-like growths that form in the colon tissue. These polyps typically appear in the final part of the colon, making them easier to detect through a colonoscopy. In most cases, these polyps can grow and turn into tumors. Over time, the tumor invades the walls of the colon and can metastasize, affecting other parts of the body, especially the liver. We should not wait for the symptoms to reach an advanced stage. It is important to pay attention to certain signs that could indicate something is wrong with the colon. The first change to watch for is unusual alterations in the consistency of your stool. If you suddenly start experiencing diarrhea when you didn't have it before, or if you encounter constipation that you haven't had before, pay close attention to this. Also, if you notice a pattern of alternating between diarrhea and constipation, this is something you shouldn't ignore. Second, the presence of blood in the stool. This is never normal, whether it's red blood or digested blood. You might ask, what is digested blood? It may appear as dark spots or streaks in the stool, or even as black or very dark brown stool, known as melena. This indicates bleeding that could be related to a tumor in the ascending colon, and melena is often very soft. If you see blood in your stool or black stool, it's a red flag. Third, if a blood test, such as a complete blood count, CBC, reveals anemia without an apparent cause, it's important to investigate. Anemia should always be evaluated, especially if there are iron deficiencies or menstrual issues in women. It's recommended to have a colonoscopy to rule out the possibility of a tumor in the colon causing hidden bleeding. Fourth, if you begin to experience unexplained abdominal pain or feel a mass when touching your abdomen, that should never be ignored. The abdomen should always be soft and compressible, without alterations. If you notice changes in this area, it's crucial to see a doctor. Fifth, unexplained weight loss is also a symptom to consider. Sixth, the appearance of frequent vomiting. This should never be considered normal, and it's important to seek medical attention if it occurs. How can we diagnose this disease and what should we do about it? The main and most reliable test is the colonoscopy. This procedure involves inserting a tube with a camera at the end through the rectum. It then travels through the entire colon until it reaches the first portion of the ascending colon, where a direct observation is made. To perform this exam, the colon must be prepared and cleaned, and during the procedure, samples are taken for biopsy. If a polyp is detected, a detailed analysis is performed, as some may be caused by inflammation or infections, while others could have tumor potential. In such cases, it is crucial to begin appropriate treatment. In addition to colonoscopy, other tests can be performed, such as blood tests or DNA testing of stool, to detect hidden blood, which is often not visible to the naked eye. It is essential not to ignore symptoms, as doing so will not make them disappear. Prevention is key. There is a brilliant book titled The First Cell by Dr. Ezra Raza, an oncologist in Los Angeles, who has dedicated her life to oncology. In her book, she concludes that the most important factor in cancer treatment is early detection. That's why I'm giving you recommendations on how to identify symptoms and when to see a doctor. This type of cancer often goes unnoticed and progresses rapidly in silence, making it too late for intervention in many cases. Remember, this is not about inducing fear, but about raising awareness, because when we take control of our health, our lives change forever. I hope this information is important to you. The entire team behind this channel is here to provide you with valuable information so you can learn to take control of your health and manage it. If you think this information was helpful to you, leave us a comment, and remember that the best way to support us is by sharing this video with others. Also, don't forget to like the video, subscribe, and activate the notification bell so you'll always be aware when we post a new video. Thank you. Until next time.